I'll never forget the first time my mother couldn't remember my name. Soon after, she deteriorated rapidly, going from a vibrant, independent woman to a spiritless, dependent one, requiring around-the-clock care in an assisted living facility. Previously, she walked everywhere, was a voracious reader and avid traveler. She sang in the choir and had successful careers in architecture, film production, public relations, and as a chef who graduated from two top institutions. She was my role model for always following your dreams. Now, she doesn't even know who I am. After she was diagnosed with Alzheimer's dementia, I couldn't stop wondering, how did this happen? She was the healthiest person I knew. She had no medical problems, no genetic predispositions, and wasn't on any medications. The only risk factor she did have was she had been in menopause for 3 decades without hormone therapy. I wondered, could menopause be the cause? Menopause translates to meno, which means menses, and pause, which means to stop. So it's the cessation of the menses that occurs when a woman's ovaries stop producing sex hormones around the age of 51. Currently, there are over 450 million women in menopause, and shockingly, this number will triple in the next 8 years. By 2030, 1.2 billion of us will be in a state of what I call hormonal poverty. Financial poverty is when you don't have the financial resources to meet your living needs. Hormonal poverty is when you don't have the hormonal resources to meet your body's needs. Hormones are chemical messengers that communicate with every cell in your body, telling them what to do. They function like the teacher in a classroom. They maintain order. Did you ever have a substitute teacher? Remember, she didn't know about the homework, the lesson plan, or how the class should behave. It was chaos, right? Just like that full-time teacher kept the class running smoothly, your hormones keep your body running in an orderly and healthy fashion. In the hormonal poverty of menopause, these hormones aren't present to prevent chaos. My mom never received hormone therapy because her doctor thought it was unnecessary and possibly dangerous. As a medical doctor with a specialty in obstetrics and gynecology, I had been trained to believe the same thing. Here I was in my 40s. My weight reached 243 pounds. I was exhausted and depressed. Yet I never once thought it was my hormones or asked, could menopause be the cause? My patients over 40 were struggling with the same midlife metabolic mayhem I was suffering with. Myriad health complaints like weight gain, fatigue, brain fog, moodiness, and at least 60 other symptoms. We were all active and engaged with life, yet we were all hurting. Midlife mayhem seemed normal because most of us women over 40 experience the same things. My traditional small toolbox of drugs and surgery I learned in my formal training failed to restore us to vitality. One day, a patient with the usual midlife mayhem came to my office after a year looking like a new woman. She had lost 30 pounds. Her hair was full. The light was back on in her eyes, and she was smiling. Turns out, she'd gone to a doctor in another town who did hormone tests and prescribed treatments I never offered her. She felt better than she had in 25 years. Right then, I realized that there was an entire field of medicine I wasn't aware of that dealt with the hormone poverty causing midlife mayhem. This initiated my 7-year journey to becoming hormonally literate. I voluntarily sought out and completed rigorous advanced training by completing a fellowship in anti-aging, metabolic, and functional medicine. I got a bigger toolbox. I learned how to treat the first warning signs of hormone poverty, reversing midlife mayhem in the process. By addressing the root cause of my symptoms, I lost 100 pounds, got off all medications, and looked and felt 20 years younger. Because of the work I did, this is what 58 looks like. How did I not know this before? As an OBGYN, I was supposed to be the expert on women's hormones. I had to forgive myself for what I wasn't taught. Turns out, it's not just me. Recent articles in the New England Journal of Medicine, Journal of Women's Health, and the Mayo Clinic proceedings expose that doctors receive little to no training in the management of menopausal women and are unprepared to treat women at this stage of life. Unfortunately, if doctors don't complete fellowship training in anti-aging, metabolic, or functional medicine, they're functionally illiterate when it comes to hormones. Sure, they know what they are and how they work, but they aren't trained in the absolute necessity for and the science and safety of hormone optimization in menopause to reverse hormone poverty and restore what I call hormonal prosperity. When most people think of menopause, they often trivialize it as purely bothersome symptoms, things like hot flashes, night sweats, insomnia. But this limited view doesn't respect the dangerous impact hormone poverty has on a woman's health. In fact, we should call these hormones flex hormones, not sex hormones, for two reasons. They have flexible functions, and deploying them is like flexing one of the most powerful muscles in the body. Flex hormone therapy using biologically identical hormones is used to treat the hormone poverty of menopause and create hormonal prosperity. These hormones have the exact same chemical structure of the body's naturally occurring estrogen, progesterone, and testosterone, the ones given to you by nature that are key factors in your growth and development to healthy adulthood. I am not talking about synthetic artificial hormones that have a different chemical structure and have been proven to be potentially harmful. The Women's Health Initiative study in 2002 showed us that. If you don't ask, could menopause be the cause when midlife mayhem shows up? Then your second opportunity to get the memo may come when disease shows up, when cells and systems aren't getting the support they need. There are flex hormone receptors in your brain. Alzheimer's is a leading cause of death and disability among older women. Flex hormone therapy for 6 or more years reduces a woman's risk of this disease by 79%. There are flex hormone receptors in your eyes. The leading cause of blindness in women over 65 is macular degeneration. Flex hormone therapy makes this 50% less likely to occur. There are flex hormone receptors in your heart. Heart disease is the #1 killer of women over 50, and flex hormone therapy in menopause for 10 years significantly reduces the risk of heart attack and failure, says the British Medical Journal. You have flex hormone receptors in your breast. Most women don't use hormone therapy because they and their doctors are erroneously afraid it will cause breast cancer, and the media has sensationalized this misconception. While this may be true of synthetic hormones with a different chemical structure, it is a fact that bioidentical flex hormones actually protect breasts from cancer. Flex hormones play a role in your immune system function. COVID infection is noted to be less severe and have a lower fatality rate in menopausal women using flex hormone therapy compared to those who don't. And it's thought that our flex hormones are the reason that women have a less serious time with COVID than men. Your bones have flex hormone receptors. Osteoporosis leading to a hip fracture is a top cause of death and disability among older women. This can have disastrous consequences, including losing the ability to walk, to live independently, all the way to death. Hormone poverty leads directly to bone thinning, and osteoporosis improves with flex hormone therapy. Stopping it increases a woman's risk of breaking a hip by 55%. Because every cell, every system in a woman's body depends on these flex hormones to prevent chaos and decay. If any health problems occur in a woman over 40, the question we should be asking first is, could menopause be the cause? But what if I told you that untreated menopause can lead to a third and worst consequence of hormone poverty? Early death. Studies show that the earlier we go through menopause and enter hormonal poverty, the shorter our lifespan. Now, on the positive side, additional studies show that using flex hormone therapy to create hormone prosperity can reduce death from all causes and increase lifespan. All of the journal studies presented in this talk are documented on this slide. Nature gives you 2 warnings that hormonal poverty is occurring. First, midlife mayhem. Second, disease. And then the final blow, early death. Menopause isn't currently listed on death certificates as a cause of or contributing factor to death like others, including obesity, smoking, diabetes, hypertension, and more. Yet it increases the risk of at least 7 of the top 10 causes of death, including heart disease, stroke, cancer, severe infections, diabetes, and dementia. My mom's death certificate won't name menopause as a contributing cause to her death. But for her and every other woman who dies in untreated menopause, the question we should all be asking is, could menopause be the cause? It's too late for my mom. She'll probably never recognize my face again. But it may not be too late for you or your mothers, your sisters, partners, and friends. So please, find a fellowship-trained, hormone-literate doctor, get properly tested for hormone poverty, and get to hormonal prosperity by replacing the identical hormones to what Mother Nature supplied you with. Your life may literally depend on it.